Hey guys, it's HINA here at Rebalance Physical Therapy and Wellness in Center City, Philadelphia, as well as on the main line in Narberth, Pennsylvania. And today I want to talk to all of you about something called lower cross syndrome. Now, if you guys are watching this YouTube video, typically some of you guys have either Google searched or YouTube searched lower cross syndrome. Or you've been diagnosed with it, or you stumbled upon it in some of your readings and you're thinking, hey, do I actually have this? Now, lower cross syndrome, in a very simplistic formation, just means that you have muscles in the back of the body and in the front of the body, and they kind of work together, meaning these muscles in the front work together with the muscles in the back, and vice versa, okay? There's like a bunch of crossed muscles. And when your posture is off, basically what can happen is certain muscles become tight and some muscles become weak. And what tends to happen is there are these muscles that have this cross relationship with each other. So when that happens, it can cause all sorts of like low back pain, hip pain, pain, like changes down in tightness into your lower legs. It can cause, tingling and numbness into your foot, because maybe that cross syndrome is a reason why you're having nerve compression. So basically, cross syndrome just means that you've got these imbalances and they can then manifest pain in many different ways. Now, if you look this up onto, let's say, a website and you put in lower cross syndrome, they're gonna say, oh, there's a type A and a type B, and if you fall into this category, this is what it feels like. You might have type A is like hip pain and type B is low back pain, and we can get into all that. But I'm just here to tell you, just in a very simple way, all it means is you've got some muscles that are tight, some muscles that are weak, and they tend to be in this cross formation, and then they can cause all sorts of pains and aches in your body, whether it's in your lower leg, whether it's in your hip, whether it's in your pelvis, and whether it's in your pelvic floor, which we're not going to talk about pelvic floor in this video. We'll talk about how lower cross syndrome can affect your pelvic floor in another video. So I'm going to show you this picture right over here. So when your posture is off, and typically I got to show you what good posture is. When your posture is good, okay, what you will see is that when you put a string and you hang it down on the side of the body, there are certain landmarks like the opening of your ear, the mid part of your shoulder, the top part of your pelvis, your hip bone, your knee joint, and your ankle bone. They should all line up in this nice straight line. And this way you have balance between the front and the back of the body. However, when your posture is off, okay, and it could be many different types of posture, and there's certain tendencies of certain muscles to become tighter in certain types of posture and weaker in other types of posture. But what you tend to see is that line no longer is straight. It is off-center and it's jagged depending on what part of the body it goes through. And when this happens, certain muscle groups are going to have to overwork and they tend to become tight and painful, and other muscle groups tend to become weak and lengthened. And when that happens, when you have this imbalance, your body no longer moves efficiently. It doesn't move well. And then when you don't move well, that just contributes to further tightening and weakening and further pain and dysfunction. And then you end up in this cyclic kind of syndrome, basically. Now, what are the muscles that tend to become tight in lower cross syndrome, and which ones tend to become weak? So, just from a simplistic standpoint, I'm going to first show you the skeleton, okay, and just a couple of the muscles in the lower body. Now, what tends to happen, I guess we talked about this cross, okay, that happens like this. What tends to happen with changes in posturing is that the abdominal muscles tend to become weak, okay, and what ends up happening is when those are weak, the hamstrings that kind of cross over to the other side tend to become tight. And then in the other direction, you start to see weakening of the gluteal muscles, okay, which are very important stabilizers for the hip and the low back and the pelvis. And you start seeing tightness in what are called the quadriceps, hip flexor muscles, and things like that. Now, when you start having these imbalances, you can see that a lot of these muscles cross into the knee joint. They can affect the foot. And then they can also have an effect all the way up into the body, but definitely the spine, because here's your spine right in through here. So if we take a closer look, okay, at some of these muscles. Again, here's the quads that tend to become tight, abdominals tend to become weak, and in the back, hamstrings become tight, and these glute muscles tend to become weak. You can see that a lot of them attach up into the spine. This is your spine right in through here. All right. So then if we look at this even further, all right, we look at the spine. Okay, these are all the different types of muscles. These are your glute muscles right in through here. These are your low back muscles, which again, the deeper ones tend to become weak too. And then the superficial ones, which are even on top of this, tend to become tight in lower cross syndrome. You can see that now it's going to affect the way the spine is stacked. And the spine, when it loses its symmetry for good stacking, okay, what basically ends up happening is your spine tends to stack like this. So if you think about your spinal segments, meaning all these joints, all right, that go all the way up into the head and neck. If they're stacking in an imbalanced way like this, all right, you can see now why some people may develop arthritic changes in their spine, because imagine that each one of these plates that stack on top of each other are joints. And imagine if there was like a nice cushioning in between those plates, all right, like a sponge. But imagine that sponge, because of wear and tear and imbalances, that sponge basically wears down on one side. And then when it wears down, it frays. And then the sponge no longer is absorbent anymore. It just becomes like a flat pancake. Well, that's sometimes what can happen in through here in the spine, is those joints become arthritic. You've heard of degenerative disc disease for some of you. That means that the discs, which again, we're not going to fully get into, there's discs that actually sit in between here that can become worn down. And then when that happens, you can develop all sorts of changes in the spine that can lead to even nerve compression that then gives you pain down into the leg, or for some of you, sciatica, okay? So what we ideally want is that if your posture is good and these joints are nice and evenly stacked up like nice even plates, then you're not gonna have this imbalance going on, and that way you move better and you move more freer. So you can see how lower cross syndrome, okay, again, which is this umbrella term that just means that there's certain muscle groups that tend to get weak, certain muscle groups that tend to get tight, and they tend to be in this cross formation. That when you have these imbalances, they can create this everything from herniated disc issues to arthritic changes to hip pain, you know, compression on one side of the hip, to labral tears, to, you know, foot and ankle issues, knee issues. And so the logical explanation, after you guys have kind of heard this, is that you want to create balance. And the way that you do that is the muscles that tend to be tight, you want to be able to stretch them and make them more supple. And the muscles that are weak, you want to strengthen them. Now, in this video, we're not going to get into all the nitty-gritty of how we're going to do that. But with good integrative physical therapy, like the one we have here at Rebalance, this is all the things that we look at. So if someone comes in and they're having, hey, I've been having this hip pain forever, and I've either tried traditional physical therapy, or I've worked with my trainer, or I've tried to DIY it myself at home, and it's not getting better, then it could be because there is this mixture of imbalances that are going on in the body. Now, this lower cross syndrome is these tendencies of these groups of muscles. But remember, you have 360 muscles in the body. And us physical therapists go to school for 2 to 3 years to really learn how all of this stuff happens. And here at Rebalance, our philosophy is that we need to treat these imbalances, and we need to treat the cause behind why you might be having hip pain, low back pain, tingling, sciatica, all these types of things. And so once you start treating those imbalances, you start to see that, hey, my pain is getting less, I'm moving better, my function is better, again, which further decreases pain. And so this is what we want to see. So if you come in with a herniated disc, don't think it's the end of the world. We need to create that balance so that these spinal stacks are now starting to become more even and you're not getting wear and tear on there. That then gives you pain down the leg. So I hope that's starting to make sense. So really good physical therapy where someone knows how to work on a lot of these muscle imbalances with a hands-on approach is going to be key to really getting this better. Now, I know a lot of you guys are living all around different parts of the country that are watching this YouTube video. Now, if you live in and around this area or you can get to our clinic, then it's awesome. Just come and see us because this is what we work on all the time. However, if you don't live in and around this area, there's a couple of things that we can do to help you. Now, one is we do phone and telehealth consults where we can kind of figure out what's gone on in your history, kind of give you an idea of what might be going on, and then help you find potentially referrals in and around your area that might be able to help. Because with a good thorough history and really understanding what's going on, sometimes we can help you find the right referral site as far as what are the qualities to look for in a good therapist near you, and who do we think is a possibility that you can connect with over there. But the other thing, and this already might be developed by the time you watch this YouTube video, we are also here at Rebalance starting to create a lot of online programs where we can start getting you to actually self-evaluate your own body, figure out what is tight, be able to work on them slowly over time, okay? And what we typically like to do is say, do 15 minutes a day for somewhere between 6 to 8 weeks, where you're really working on understanding your body and getting to know it. Because knowledge is education. Knowledge is also decreases stress and empowers you to really understand what's going on. So I do have a question for some of you. And depending on when you're watching this YouTube video, we may have already created this program. But for some of you where the program hasn't been created, would you guys want a program, if we developed it, that basically hones in on lower cross syndrome, exactly what to do step by step, how to work on the right musculature, and also how to strengthen in the correct way? So that all these things like herniated discs and degenerative disc disease and postural tightnesses and imbalances and aches and pains start to improve, so that you have the knowledge and the power to do that. So if you do, we would love to hear from you. Shoot us a comment below and say, yes, I would love to have that. Because like I said, here at Rebalance, this is what we want to do, especially in the light of the new world that we are living in, where currently not everyone can easily go out and see a physical therapist, or for some of you who can't afford to see a physical therapist. So we wanted to give you that option and the ability to do that. And of course, at some point with our continued, if you subscribe to our YouTube videos, we do put a lot of pointers and things like that out there so that eventually you might have a couple of things that you can start doing to kind of address some of these muscular imbalances. However, having a good solid program that you can follow every single day for 6 to 8 weeks can probably make a huge world of a difference on how you are feeling, which is going to give you a positive attitude and outlook on life and just make you feel good and improve your quality of life. Now, we also have lots of other YouTube videos. I encourage many of you guys to watch them because you'll see how lower cross syndrome can basically also tie into other things that might be going on with you. Check out our website. We have lots of helpful blogs. You can sign up for our blog posts. And then, of course, if you guys are interested in the program and if it's not already developed, if it's already developed, it's going to be in our description right underneath this video. But if it hasn't been, we would love for some of you to comment and let us know if you would be interested in that, because we will then really highly consider developing that program and having it available to all of you. So I hope that makes sense and you guys got some helpful information out of this, and we will talk to you soon. Have a wonderful day.